This is a special episode for us because we are talking about the work of Allergy and Asthma Network. They are our producing partner and the reason Dr. G and I met in the first place. We're joined by their CEO, Lynda Mitchell, who's also an allergy and asthma mom. She joins us to talk about the wide range of work the organization is doing, and trust me, there's a lot. So, whether you're a patient or a healthcare provider looking to make an impact, this episode is for you. This podcast is made in partnership with the Allergy and Asthma Network. Now let's get to it. You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology.
Today, we are interviewing Lynda Mitchell, who is the CEO of the Allergy and Asthma Network, which we have a very special partnership with, and we love working with them. We love working with Lynda. Lynda has 25 years of experience in the nonprofit leadership world. And so today we're going to learn more about Lynda Mitchell, and we're also going to learn more about what the Allergy and Asthma Network does, because they do so many wonderful things. And we just really wanted to highlight the organization and help everyone else understand all the various programs that they have available. Thank you, Lynda, for joining us. Can you take us back to what first pulled you into this work and how being an allergy and asthma mom affected you and likely pulled you into this world?
Yeah, thanks for having me, Dr. Gupta and Kortney. Really appreciate the time to be here and to tell a little bit about me, and brought me to Allergy and Asthma Network and also to this world that we are working in. So I had a little baby back in 1990 who turned out to be one of those first kids with multiple food allergies, anaphylaxis, and asthma. And I was struggling to understand because back in 1990, there was no information really. There was very little published research. A lot of doctors didn't have any understanding of food allergy. And so it was one of those things where I had a healthcare background and I was trying to understand this. And it really led me to change course with my career, which is common with food allergy moms because of how much time and care you have to be available for your child. Is many moms of children with food allergies either quit their jobs, they'll change careers, or they'll go part-time. And I was one of those moms. So I went back to graduate school and I came out with basically a business plan to start an online support community for families raising children with food allergy. And that's what took me on this journey. It started back in 1998 and grew it from a listserv to an online nonprofit support community, and then branched out into the asthma and allergy world as a whole.
Lynda, I love that. I feel like if my mom was more internet savvy back in the 90s, she would have become one of your best friends because she was definitely on that journey. I think that what she couldn't do with her tech is what I ended up doing when I left home and started my own blog. So I love your journey. And I feel like that's something we hear a lot. And I also just love listening to OG allergy moms because I start to understand mine so much more. So it's amazing therapy for me. So thank you. Thank you for sharing your journey. We love the Allergy and Asthma Network here on The Itch because without the Allergy and Asthma Network, we wouldn't exist because that's how Dr. G and I met. But before we get into that side of the Allergy and Asthma Network, for our listeners who don't really know much about it, can you tell us what the mission of the Allergy and Asthma Network is?
Well, we're trying to improve people's lives, improve outcomes, and overall make lives healthier, safer, and better for people living with allergies, asthma, and related conditions. And when I say related conditions, it's conditions that have an immunological basis. Dr. Gupta can explain better than me about that, but that they often end up with very similar treatments as allergic conditions. And so we feel a need because we want to create reliable educational resources and advocacy for these other populations who are dealing with these conditions.
Yeah, and that's part of the reason that I went into allergy is because we really treat the whole body, and there are so many conditions from the skin to the eyes to the nose to the lungs to the gut to the immune system that are really all interconnected. And that's what I love about the Allergy and Asthma Network. You're really focused on providing care to all of our patients as allergists. And that's really key, is understanding that there is an organization that provides lots of patient advocacy and lots of patient education materials and even education to physicians. So can you tell us how the organization has evolved over the years as science and treatments and patient needs have changed?
Yeah, Allergy and Asthma Network's 40 years old, and it started with Nancy Sander, who again was a mom of a child with food allergies and asthma. She sat at her kitchen table and wrote a newsletter and shipped it out to, turned out to be thousands of other moms, and it was called Allergy and Asthma Network Mothers of Asthmatics back then. From there, the mission kind of grew. There was a need for more advocacy work, and so Nancy got very involved in passing state laws and getting, really important things going like stock albuterol, stock epinephrine in schools. The Food Allergy Labeling and Consumer Protection Act way back in the 2000s was something that I worked on when I was working in the food allergy online community, but Nancy was too. And then about 10 years or so ago, there was just this increasing need to do more patient-centered research. And so Allergy and Asthma Network expanded into that area as well. And then I should also say we do Hispanic outreach and have done that for about 20 years because there's a need for that. And then we go into communities and also bring educational materials to communities that maybe aren't connected to Allergy and Asthma Network online.
Yes, and I appreciate that the staff at the Allergy and Asthma Network also really understands that space, and you've made an effort to make sure that the educational materials you provide for people that are Spanish speaking are helpful and really resourceful. And sometimes organizations try to do that, and I don't think that they do as good of a job, but I think having people on staff that really understand different communities is very helpful.
Great. Yeah, we've got a pretty diverse staff. Great. Multilingual too. What we do is we listen to patients and caregivers and we try to understand the needs and the gaps and what they might need that isn't already out there. And then we take those learnings and we translate that into resources. And we work with patient advisors in order to make sure that these resources are relevant and on target with what their needs are. And then we engage different ways of communicating the availability of these resources. Again, years ago, people just would come to our website or get that print newsletter. Now we have to go where people are, whether they're on social media or in other venues. We need to just meet them where they are and get the word out about this availability. And sometimes it's videos of people from those diverse communities delivering the messages as trusted messengers. And that's something that we take very seriously and make sure that we have trusted people delivering those educational messages.
I know that the Allergy and Asthma Network has 4 mission pillars. Can you talk about what those are to help people really understand what the Allergy and Asthma Network does?
So our 4 mission areas are education, outreach, advocacy, and research.
Okay, so let's go through each one of these mission pillars and really tell people exactly what you're doing. So you said the first one is education. Can you talk a little bit more about how you're providing education?
Well, our primary audience to educate are patients and caregivers. So we do that in a variety of formats. We have lots of website content, but we also use social media a lot for outreach and to be able to give educational messages beyond our website. And then we also go into under-resourced communities in our Trusted Messengers outreach program. We send asthma educators with print materials and go and they exhibit and they meet one-on-one with people in local communities and just provide that one-on-one educational information to give people the information that they need.
So you mentioned Trusted Messengers. Can you talk a little bit more about what that means?
Well, Trusted Messengers is a program we have, but really it conceptualizes the concept of a trusted messenger who is someone who lives in a community and is known by the community and is trusted by the community. So in certain communities, faith-based leaders are really important trusted messengers. In many communities, it's someone who looks like the community who can come in and speak with the community as just one of the community.
Thank you, Lynda. I think that being a part of the community is so important, and I've seen that in my work as a doctor. Trust is so important in health. understanding that a message is coming from a trusted source is one of the most important things. And that's what we learn as doctors, is that you have to build trust with your patient before they're going to follow your recommendations, right? And so even as an advocacy organization, having that ability to create that level of trust is so important, because you can have all the right educational materials, but if you don't have the trust of the community, that community is never going to implement those resources into their lives.
And also seeing diverse patient populations show up with your messengers is really, really strong for me. I know that if we just look at an example of my grandma, she likes doctors who look like her, right? She wants someone to know that they understand her cultural background. And I think that's a message that the Allergy and Asthma Network also shares. So I just appreciate seeing diverse representation, because I know that sometimes you don't think that you are normal if you feel like everyone looks a certain way that has an allergic condition and you're the only one who doesn't look that way. And as a kid, that was kind of something I dealt with. And now I see a lot more representation, and I really, really appreciate that. And talking about just representation and speaking language, outreach is part of the mission pillars. Can we talk a little bit about that?
Sure, yeah. So our outreach includes media outreach, public service campaigns, and then our main health equity program is called Trusted Messengers, community outreach. And then a component of that program also is a virtual asthma coaching program. We send asthma educators into areas that experience high burden of asthma, and we send them with educational information, and off they go. If we're going into a Latino community, we send people who speak Spanish, and they meet with individuals one-on-one at health fairs and just go through and explain the conditions and how they can get more help and hand out educational resources. And then people who have they fill out a survey, and if they have asthma, they're invited to participate in a free virtual asthma coaching program, which is a follow-up to the event that we go to. And that program has shown over the years to just make such a difference in bringing people's asthma under control, keeping them out of the emergency room and hospitalization, just feeling better overall, sleeping better at night, fewer symptoms, less use of rescue medication. It's just been a wonderful program to see. And the individuals that have gone through it are just so grateful because they get this one-on-one personalized coaching.
And I just want to emphasize that it's a free program that the Allergy and Asthma Network provides to patients. As somebody that works with asthma patients, it's so important to have that resource where you really get that one-on-one education. And this is the few times where you are able to get that hand holding. And so I think it's a great program, and we'll definitely link to that in our show notes for anyone that's interested.
Yeah, I should add, it's an asthma self-management education program. It's not prescribing anything. It's not doing anything in terms of medical care. It's just teaching people how to manage their asthma, how to use their controller, how to use an asthma action plan, monitoring your symptoms, knowing when to report it to your doctor, just better day-to-day management of your asthma. And believe it or not, that's really key to asthma control. Is there's a lot of self-management competence that needs to happen in order for people to know how to confidently manage their asthma.
And I also love that the Allergy and Asthma Network not only does these programs, but then also takes the time to do research on these programs to make sure that they're effective. And if they're not effective, what can you do to make it better? And I think that that's the only way to make a true difference. And so research was one of the other pillars. Can you talk about other research areas that the Allergy and Asthma Network is focused on?
So research is one of our core pillars. And what we do is we don't do clinical research. We don't do anything with drugs. We are doing what's called patient voice research. That means we're trying to understand the patient's point of view, what their needs are, what their preferences are, what they like, what they don't like. For instance, what the economic burden is associated with living with these conditions. And then we compile it into research reports and publish it in the literature so that other healthcare professionals can learn about what we have found regarding the patient's life and patient's experience.
What I'm hearing and what I love is that the Allergy and Asthma Network puts the patient first, right? So with everything that we've talked about, the patient is always in mind. And the beauty of the research, and like what Dr. G was saying, is that the patient is the guide. I appreciate that so much, because sometimes you feel like you're battling this alone, and just for other patients to know that you can get involved and you can help make change. And one way to do that is to get involved with the Allergy and Asthma Network and to find a way to lend your voice. And maybe that's a perfect time to talk about advocacy.
Well, before we go there, I'd like to just point out, we in the past year have worked with dozens and dozens of patient advisors who we bring on just to understand their life experience and get their opinions and get their feedback so that we can make whatever we do better, whether it's education, advocacy, outreach, or research. But one of the other things that we also do is we work with clinical trial recruitments and getting patients and caregivers involved in the whole scientific process from discovery of a drug all the way to it getting approved, because the patient voice is really important in order to recruit for clinical trials. You need to make the recruitment materials meaningful and clear and in a language that people understand. And you need to know how to reach people in various venues. And so our patient advisors are really so important to inform the whole process so that we can make recruitment successful. And that leads me to saying diversity in clinical trials is just something that we always are working towards to try to help our industry partners get important people connected to clinical trials, because we want the clinical trials to represent the whole community, not just white men. And the way we do that is we get a diverse group of patients involved in planning the clinical trial, and then hopefully that will lead to enrollment of a diverse group of people in the clinical trial.
Absolutely. Diversity in clinical trials, we can't emphasize how important that is, because we know that every human body is different and we do have differences in the way that we may respond to medications. And so understanding what that looks like and understanding which medications may work better for one community versus another, all of these things, we can't figure that out unless more people are a part of these clinical studies to really help understand how different people respond to these medications. And that's been challenging because historically people of different communities have not received the type of care that they deserve. And so I think undoing a lot of that mistrust is really important. And that's really what the Allergy and Asthma Network is working really hard to do, is listening to those patient voices, understanding what their fears are. And oftentimes as doctors, we don't get to do that. Patients sometimes, even though they may trust us, they're also worried about what they say to their healthcare provider. And we recognize that as physicians. I know that patients may be worried about what they're telling me, but when they're working with the Allergy and Asthma Network, they may be able to share all of their insecurities and fears. And that is so important for us to understand as a medical community so that we can advance research, make sure those educational materials are relevant, as you mentioned, and make sure that we're answering all the questions that patients have that we may not even know as doctors. And so I was telling Kortney this the other day, we don't know what we don't know, right? So sometimes we've learned this other language as doctors from the time we're really like in our early 20s. And sometimes we don't know how to turn that off, right? Like our brain has another language. And when we're speaking to patients and when we're speaking to their caregivers, we're talking in a different language. And sometimes we don't even realize that. And so I think advocacy organizations and patient organizations are so important to help bridge that gap, to make sure that patients are actually understanding what we're saying. That's why I love advocacy organizations. I know how important it is. And I think sometimes we don't realize how big those gaps are.
Well, we take complex topics and we break them down to a grade 6 to 8 reading level so that people can understand them in plain language. To close up regarding research, we're even taking research studies and making them in plain language as well so that people can understand these complex clinical studies and what it may mean to them in a very digestible way.
And then advocacy. So as Kortney mentioned, we wouldn't really know each other had it not been for the Allergy and Asthma Network, because we met at the day on Capitol Hill in Washington, D.C. in 2018. And so it's a very special event. And I really want to spend some time talking about that day and the other advocacy work that you do.
We do federal and state advocacy. We have 5 policy priorities that we focus on, all of which are important to the asthma and allergy and related diseases community. And then we work towards May, where we hold an annual Capitol Hill Day, where we bring people in, their families, and we empower them with basic information so that they can go meet with their legislators and talk about the important aspects of these policy issues that we would like bills to pass for. But most importantly, they lend their patient stories to this to bring it to life. So if we want to pass, say, epinephrine legislation, we want people to be talking to their legislators or legislative aides about what that means to them, how important that bill would be to them. And that's why the patient voice is so important, because it brings the actual issue to life in a way that somebody like me going up there and talking to legislators wouldn't have nearly the impact.
So, Lynda, you talked about bills and legislators and all of these terms that may be hard for people to understand. But after having been to the day on Capitol Hill, I kind of understand these terms. And I think that what's important to understand is that our healthcare depends on what is being done by the government. And there are laws that are being passed that we can have a direct effect on. And that's really what advocacy is. And that leads us into a program that the Allergy and Asthma Network is putting together to help people understand all of these terms and also understand how to effectively communicate. So, can you tell us a little bit more about PALI?
Yeah, so we have patients and kids and caregivers who want to tell their story to legislators, but they don't have the confidence or know how to do it. And so, what we're going to be doing with our Patient Advocacy Leadership Initiative, or PALI, is we're going to have an ongoing training program. And what we want to do is we want to build a world where people know how to confidently contact their legislators and tell them about what they're experiencing and how laws need to pass to make their lives better. And so this PALI training program is designed to do that. It's starting just now. We announced it last week, and there's information on our website about an information session that we will be holding on February 18th for those who may want to find out more. We would love to have more people involved because it's going to be a training program, but it's also a confidence building session so that you can learn about the bills and then how to approach your legislators and how to get involved as a community.
Lynda, can we just quickly, before we end this episode, just talk about what it means to be a not-for-profit organization, just so patients understand what exactly that term means when they hear it?
Sure. So, Allergy Asthma Network is a US based tax exempt charity. And that means we raise money and pay for our bills, so to speak, through donations from the public, from grants, from sponsorship revenue, and everything that we earn goes back into making our programs better. That's essentially what a nonprofit organization is. So all of the donations that we receive, all of the sponsorship revenue, all of the grants that we receive are directly going to be impacting the work that we produce and make available to everyone.
So, as a not for profit organization, you're really held accountable for your mission statement, and there is a lot of oversight. Isn't that true, Lynda?
There's federal reporting requirements, and then there's charitable registrations by state. There's a lot of oversight of a tax exempt organization like ours. And then on top of that, we are a member of the National Health Council, which layers on another 38 standards of excellence that we aspire to meet in order to show accountability and trustworthiness.
Is there anything else, Lynda, that you want listeners to know about the Allergy and Asthma Network as we close out this episode?
Yeah, I would say get involved, learn more about what Allergy and Asthma Network does if you're not familiar with us. There's a lot of great advocacy organizations out there, but we all have our unique strengths and capabilities. And so, there might be something that we offer that perhaps you won't find available elsewhere. Everything we offer is free. You can start by just going to allergyasthmanetwork.org. Check out our homepage, but scroll to the bottom. You can sign up for our free newsletter, and that will stay you plugged into what our events are and what our monthly news is for the allergy asthma related diseases community and how you can get involved.
I would love to just share my story because I've been involved with the Allergy and Asthma Network for like 9 years, I would say. And I started back when I was a blogger, and I actually used to write for the physical magazine that was printed back in the day. But for me, it was an amazing experience at the beginning because I didn't realize that as a patient, you could actually have an impact and that you can do more than just complaining to your spouse and friend about the healthcare system, but you can actually go out, share your story, get to Capitol Hill one day if that's something you can do, and feel empowered as a patient. And really, like, the word empowered is a strong word here. And I know sometimes it can be overused, but in this case, it's you really feel like you get to know your disease, but you also get to know how you can impact your health. And by that, it's like what Dr. G was saying is like, we can have an influence on the system. And sometimes we feel powerless, but actually you can find a way to get your voice heard. And that's what the Allergy and Asthma Network has shown me and has guided me towards. And I'm really thankful and blessed that I've been able to work with the Allergy and Asthma Network for 9 years. And now I'm much more involved with the Allergy and Asthma Network and get to see behind the scenes what amazing work is being done with patient advisory groups and really how the patient voice is impacting the educational material that goes out online. So I just want to say that I have been involved with the network, so I might be a little biased, but I really do love them.
Thanks for the testimonial, Kortney.
One thing that I just want to quickly mention before we end the episode is that as I started to get involved with the Allergy and Asthma Network, I have just been blown away by the number of programs that are run on a continual basis, the number of people that are helped, but just there is so much going on and so many different ways to get involved. And even as a physician, there are a lot of opportunities to help with the Allergy and Asthma Network. And so even if you're a healthcare provider and want to get involved, you should also look at the Allergy and Asthma Network. And it's a great way to help in a different way and make sure that our patients are taken care of.
Thank you so much, Lynda, for being on and sharing what brought you here and what the Allergy and Asthma Network does. We are going to have all of those links in the show notes so you can head there and make sure that you get involved, because I'm telling you guys, it was a game changer for me as a patient. It really was. And your voice can be heard. I promise you. You just have to find the right way to do it. And we've got the link for you so you can start that journey.
Thank you, Kortney. Thank you, Payel.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.